This medicine is prepared under class 3 and fresh leaves of Abrotanum is used in the preparation of medicine. But can anyone tell me the common name of Abrotanum? Oh, very good, excellent. Southern wood and lady's love. But can you tell me the family of Abrotanum? That is very good, excellent. Composite is the family. But if you're saying ladies love, so can anyone tell me the common name which are having beautiful lady? Beautiful lady is the name of which medicine? Beautiful lady is the common name of which medicine? Can anyone tell? That is very good, excellent. Belladonna is the medicine which is also known as beautiful lady, but Abrotanum is known as lady's love. You can see. And this medicine is proved by Deventer, Gatchel and Cushing. So, let's talk about the symptoms of actually details of the name has not been given in the book. Okay, nowhere it is given. Okay, that's why I can't tell you right now. Okay, I will tell you in the next class. Okay, if I will get. Okay, okay, but actually suppose if I will ask someone, like if I will ask your name, so nobody can ask the question why you have kept this name. Suppose if someone's name is Rahul, so why he kept Rahul, nobody is going to tell. Okay, why Sandeep's name is there, nobody is going to tell. Sometimes only 5 to 10% is reason is there, otherwise 95% there is no reason for the name. Okay, right? Let's start with very good. Let's start with the symptoms of Abrotanum. That is alternate constipation and diarrhea. Means if the patient is coming to you, then he will complaining that Doctor Sahab, I am having diarrhea. But sometimes I am having diarrhea and sometimes I am having constipation. Like if the patient is coming to you, he will say, since 2 days I am suffering from diarrhea. But आज मुझे कब्ज हो गया, means today I am having constipation. Means sometimes the patient is having constipation, sometimes the patient is having diarrhea. But what is diarrhea? Can anyone tell what is diarrhea? Diarrhea means passing of watery stool more than 5 to 6 times in a day. That is known as diarrhea. And what is Lienteria? Can anyone tell the meaning of Lienteria? Lienteria means passing. Very good, excellent. Very good. Okay, I am teaching Abrotanum. Okay, and if we are talking about alternate constipation and diarrhea, so can anyone tell me the more medicine about alternate constipation and diarrhea? और क्या क्या medicine है? Can anyone tell? Antimcrude, sulfur, very good, and Nux vomica is there, very good, and very good, Devospita. Veratrum album is also there, and one more is there, that is Podophyllum pelticum. But someone said yellow. Yellow is not there because in case of yellow there is mention headache alternate with lumbago. Okay. But if you are talking about the alternate constipation and diarrhea, so here we can correlate with the practice of medicine. We can correlate with the disease condition. So can anyone tell me the disease condition where we will find alternating constipation and diarrhea? Can anyone tell me? Yes, very good, excellent. IBS is the condition, means irritable bowel syndrome. where we will find alternate constipation and diarrhea. But if you are talking about alternate constipation diarrhea, then here we can correlate with the organon of medicine. So where we can correlate? We can correlate with the alternating action. Okay, alternating action. Can anyone tell me where it is mentioned in organon of medicine? Can anyone tell? This is mentioned in aphorism number 115, means 115, 115 में mention किया गया है. Okay, but can anyone tell me the examples of alternating action is mentioned where? Can anyone tell me the aphorism number? Examples of alternating action. Pardon? Very good, Devasmita. 251, very good. Can you tell me the name of medicine where examples are given? Very good, excellent. There are four medicine, that is belladonna, bryonia, rustox and ignatia is there. These are the examples of alternating action which is mentioned in aphorism number 251 of organon of medicine. Okay. But if you are talking about alternating constipation and diarrhea, here we can correlate with the another medicine like calibi is there. What is mentioned in calibi? There is mentioned rheumatism alternating with diarrhea and alternating with the dysentery. That is the symptom of calibi. Another symptoms of Abrotanum is marasmus of children with marked emaciation, especially of legs. You can see in the picture. A marasmus baby is there in the picture. And if you will look, the legs of a baby, very thin, lean thin, means marked emaciation, especially in the lower extremities. But in the bracket, there are so many medicine. Can anyone tell me the more medicine? In the bracket, there are iodum and yes, iodum tuberculinum and sanicula is there. Okay, and acetic acid is also there. These are the medicine where there is mentioned marasmus. Okay, but if you are talking about the marasmus, so here again we can correlate with the practice of medicine with the disease condition. Why the patient is having marasmus? Because there is a problem with the PEM. PEM means protein energy malnutrition. If there is a deficiency of PEM, means protein energy malnutrition. So the patient will be having a marasmus and kwashiorkor. But if you are talking about marasmus and kwashiorkor, so can anyone tell me the difference between kwashiorkor and marasmus? Can anyone tell? Means marasmus looks like a date, but he will be very active. Marasmus मरा हुआ दिखेगा, but he will be very active. But in case of kwashiorkor, the patient is obese. Why obese? Because there will be a enlargement of liver, that is known as hepatomegaly. Okay. Another symptoms, the skin is flabby and hangs loose in folds. Why there will be a hanging skin? Because there is a problem with the PEM, protein energy malnutrition. That's why there will be a hanging skin. But here hanging skin we can correlate with the another medicine, that is Sabardila. In case of Sabardila, there is mentioned sensation as if hanging skin, losing and swallowing over the skin. That is what mentioned in Sabardila. Another symptoms in marasmus, head weak and cannot hold it up. Why? Because a patient, if the patient is having marasmus with the problem of protein energy malnutrition. So there will be a problem with the calcium. If there will be a low calcium, so there will be a weakness of spine. It can be cervical spine. So the patient cannot hold it up. That's why the patient cannot control his head. Why? Because there is a weakness. If there is a problem with the pain and calcium, so the patient cannot control his head. In the bracket, another medicine is there, that is Ethuja synapium. Okay, you can see in the picture. A patient is in one picture, a patient is standing with the control. In another picture, a patient cannot control his head. Another symptoms, marasmus of lower extremities only. What we have seen in the previous picture, there was a marasmus in the lower extremities only. Why? Because the patient is suffering from the protein energy malnutrition. Okay. But if you are talking about the marasmus of lower extremities only, then we can correlate with the chain tripodry. So where we will find in the chain tripodry, under which chapter, can anyone tell? We will find under the extremities chapter of the chain tripodry. If you are talking about the chain tripodry, which is starting from the mind and ending with the genitals, and chain tripodry is containing 37 chapters. So where we will find marasmus of lower extremities only? We will find under the extremities chapter, and extremities chapter, which is also known as largest chapter of the chain tripodry. Okay. And here we can also correlate with the another medicine, that is acetic acid. So what is mentioned in acetic acid? There is mentioned marasmus of the whole body and other wasting disease of children. Miss, what is the meaning of other wasting disease of children? Miss, a patient might be suffering from the CA, a patient might be suffering from the tuberculosis. In this condition, we will find a marasmus of lower extremities or over the whole body, okay, etc. Another symptoms, ravenous hunger. If you are talking about the ravenous hunger, means a patient can eat after eating. Means suppose if there is a friend in your circle, in a group, he can eat after eating. Like अभी उसने खाना खा लिया, पेट भरा है, but if you will say let's have party, then he will say yes, let's have party. Why? Because he is having ravenous hunger. Means पेटू, जिसका पेट भरा हुआ उसके बाद भी, means there is a fullness of abdomen, but he can eat. That is the character of ravenous hunger. If you are talking about no problem, ravenous hunger, okay, ravenous hunger, which is also mentioned in iodum, and another medicine is Stavesgria, and there are so many medicine, etc. Okay, but there is a ravenous hunger, but losing place while eating well. A patient is having hungry, a patient is having ravenous hunger, but the patient is having lean thin. Why? Because there is a problem with the assimilation. Means a patient is eating, but there is a problem with the absorption, like silesia. In case of silesia, there is also mentioned about the problem with the assimilation. Okay. But if you are talking about the ravenous hunger, so there are so many medicine, what I have said, iodum and Stavesgria is there. But if you are talking about Stavesgria, so what is mentioned there? In case of fever, if you are talking about Stavesgria, in case of fever, there is a ravenous hunger before day attack. Means if the patient is going to suffer, before attack, the patient is having ravenous hunger. Suppose उसका like अगर कोई patient आपके पास आता है, if the patient is coming to you and he is feeling like I will be suffer from fever, so he will be having more craving. because there is a ravenous hunger, but especially in case of fever. That is the character of Staphyscria. Okay. Another symptoms, rheumatism for the excessive pain before the swelling commences and from suddenly checked diarrhea or other secretion. Alternates with hemorrhoids with dysentery. You can see in the picture. What is rheumatism? Rheumatism means if there is a pain in the muscle and which is associated with the bone, that is known as rheumatism. But rheumatoid arthritis is something different, which generally involves the small joints. Okay, which generally involves small joints. But if you are talking about the rheumatoid arthritis, so can anyone tell me the what are the deformity we will find in case of rheumatic arthritis? Can anyone tell if we will correlate with the practice of medicine? Can anyone tell? What? I am not getting. Very good, excellent. Very good, Subhansa and Arya. We will find jet neck deformity and swan neck deformity. Okay, and and suppose how the patient will express to you. Patient will express, Doctor Saab, I was suffering from the diarrhea and after that I took few of allopathic medicine and after that I got relief. But after sometimes I am having rheumatism. I am having pain in my fingers or joints. So in this condition we can think of Artemisia abrotanum. And another symptoms alternates with the hemorrhoids with the dysentery. Means there is alteration, or sometimes the patient is having diarrhea, or sometimes the patient is having dysentery. Okay, so so alternate with hemorrhoids with the dysentery. There are so many medicine, like one more medicine is there, Collinsonia canadensis is the medicine. Okay. Another symptoms, gout, joint is stiff swollen with the pricking sensation, wrist and ankle joints painful and inflamed. So you can see in the picture, in the first picture you can see if the patient is having gout, means there is a problem with the purine metabolism, means those person who are eating too much meat and all those things, they will be having problem with the purine metabolism. Question always has been asked, if there is a question with the practice of medicine, especially related with the gout, so there is a question, gout is related with the which metabolism, like purine metabolism or something else. There will be 3-4 answer option will be there, but correct answer will be purine metabolism. Okay, but what type of pain we will find? There is a pricking type of pain, means something is pricking, like needle like pain will be there. Okay, especially in the wrist joint, and there will be a swelling of the joint. Okay. Another symptoms, itching chilblains. If you are talking about itching chilblains, there are so many medicines, like 2 to 3 medicines, like Zicum is there, and one more medicine, that is Agaricus muscarius is there. Another symptoms, great weakness and prostration, a kind of hectic fever with children unable to stand. You can see in the picture, a patient is there who is trying to stand, but he is unable to stand. Why? Because the patient was having a hectic fever. Hectic fever का मतलब क्या होता है? Associated with the chilliness and sweating. Chilliness होगा and sweating काफी ज़्यादा होगा, so there will be a loss of vital fluid. If there will be a loss of vital fluid, so the patient will be having weakness. Why? Because loss of vital fluid होने की वजह से क्या होगा? Electrolyte imbalance होगा, जिसकी वजह से dehydration हो जाएगा and the patient will be having great weakness. But if you are talking about great weakness, so we can correlate or compare with another medicine, that is arsenic album. So what is mentioned in arsenic album? There is mentioned great prostration with rapid sinking of vital force. Means great prostration. Means a arsenic patient doesn't know about the weakness, but when he will come to know that there is a weakness, when the patient is walking and wake up from the bed and he will try to walk. Means जब तक बेड पे लेटा है तब तक कोई प्रॉब्लम नहीं है आर्सेनिक को, लेकिन जैसे ही बेड से उठता है he find himself so weak, बहुत कमजोर. That is the character of arsenic patient. Okay. अभी 5 to 10 मिनट्स में ये सेशन एंड हो जाएगा ऑटोमेटिक. सो यू हैव टू वेट फॉर द 4 minutes. अगेन यू हैव टू ज्वाइन आफ्टर 4 minutes. ओके, एंड सेम लिंक. ओके, यू हैव टू ज्वाइन सेम लिंक. ओके, remember it. Okay, another symptoms: child is ill-natured, irritable, cross and despondent and violent, inhuman, would like to do something cruel. Means a child is always irritable, means he will not behave properly, and if you will put in front of him, he will throw it, he will destroy it, and always he will not sit in a silent mode and he will not be a cool mode. Okay, always he will be doing something. Suppose if he will be sitting in your clinic, he will destroy all the medicine. That is the character of Abrotanum. But the patient will looks like a old. He looks like a old. What is written? Face old, pale and wrinkled. Means a baby is there, but he is looking like too old. If you will look the picture of the Abrotanum, he will looks too much old. I think he is 10 years old, but he is looking like too much older, like he is looking like 70 to 80 years of age. But if you are talking about face old, wrinkled, why there is face old, wrinkled? Because the patient is suffering from the marasmus and because the patient is having problem with the protein energy malnutrition. So can anyone tell me the more medicine about this symptom? Face old, pale and wrinkled. Can anyone tell? What? What? Pardon? Very good. And very good, Linam. Lycopodium, very good, Nilam. And opium is there. And very good, Raj. Opium is there. And one more medicine, that is creosote. Okay. And one more medicine is there, that is argentum nitricum. Okay. Another symptoms: nosebleed and hydrocele in boys. If you will look in the first picture, okay, if you will look in the first picture, you can see a baby, a child is having hydrocele, and if the patient is coming to you and which is the patient is having hydrocele, means a hydrocele is associated with the nosebleed. But if there is a nosebleed which is associated with hydrocele, then we can think of Artemisia abrotanum. But if you are talking about nosebleed, so can anyone tell me the sources of nosebleed? कौन सी आर्टरी से ये होता है? Can anyone tell the sources of nosebleed? Can anyone tell me the name of artery? That is very good, Demosmita. Here we can correlate with the anatomy. We can say there is a sphenopalatine artery is there. Through that artery there is a nosebleed. Okay. Another symptoms: great weakness after influenza. Means if the patient is suffering from influenza and is having great weakness, so we can think of Abrotanum. But here we can correlate with the another medicine like Eupatorium perfoliatum. But what is mentioned there? There is mentioned great prostration after epidemic influenza. In the bracket, Caliphos is there. And one more medicine is there, that is ars iode. Okay. But what is the difference between Eupatorium and Abrotanum? In case of Eupatorium, there will be a weakness, but there will be a bony pain. Means there will be a pain which is involvement with the bone. But in case of Abrotanum, there is no bony pain, especially there will be a weakness. And itna weakness hoga, patient is unable to stand. Okay. Another symptoms, ill effects of suppressed condition, especially in gouty subject. Suppose if the patient is having suppressed condition like either secretion or diarrhea or dysentery or leukorrhea is there, which is suppressed by the allopathic medicine. Okay, so in this condition we can think of Abrotanum. But if you are talking about allopathic medicine, then we can correlate with the organon of medicine with aphorism number 74, means artificial chronic disease. Okay, but can anyone tell me which disease is mentioned aphorism number 77? 77 में क्या mention है? Can anyone tell? True chronic disease, which is also known as inappropriately named chronic disease, and that is pseudochronic disease. Very good, Ras. Very good. Another symptom, a sensation or stomach feels as if swimming in the water. Means patient, if he will come to you, then he will say, Doctor साहब, ऐसा लगता है कि मेरा पेट जो है ना तैर रहा है ऐसा. He will say that my stomach is floating in the water or swimming in the water. But here we can correlate with another medicine. If the patient is coming to you and he is saying that sensation as if heart is swimming in the water, अगर पेशेंट कहता है कि ऐसा लगता है मेरा हार्ट पानी में तैर रहा है, तो कौन सी मेडिसिन है? कैन एनीवन टेल मी द नेम ऑफ मेडिसिन? Can? Yes, very good, Sangeeta. Vifurana is the medicine. Okay, Vifurana is the medicine. Very good. Another medicine we will read, that is AbeisCanadensis. Okay, AbeisCanadensis. Okay, if you are talking about AbeisCanadensis, which is also known as Pinus canadensis and Hemlock spruce and Canada peas. And this medicine is proved by Dr. Gatchel, and this medicine is belonging to the conifery family. Like Symphytum is also there, which is also belonging to the conifery family. So let's talk about the symptoms of AbeisCanadensis. Mucous membrane are affected by the AbeisCanadensis, and gastric symptoms are most marked. Means if you are talking about the AbeisCanadensis, especially there is an involvement of the mucous membrane and especially related with the gastric symptom, and catral condition of the stomach is produced. You can see in the problem of the gastric problem, there can be a nausea and vomiting, there can be abdominal bloating, and there can be a indigestion, there can be a burning feeling, and loss of appetite may be there, abdominal pain may be there. Okay, this type of AbeisCanadensis symptoms may be there, especially related with the gastric problem. Another symptoms, was to lie down all the time. The skin is cold and clammy, hands cold and very faint. You can see in the picture. Means a patient is always want to lie down. You can see in the picture. Patient हमेशा सोना चाहता है. Why? There may be so much sweating, that's why the patient feels. So I was talking about wants to lie down all the time, skin cold and clammy, hands cold and very faint. But these symptoms we can correlate with the another medicine, that is capsicum enum. Capsicum patient is always wants to lie down, especially the patient is sleeplessness and when the patient is alone. But if there is a skin cold and clammy, so can anyone tell me about the cold sweat? Can anyone tell me the more medicine about cold sweat? Mm, very good. Carbobase, very good. Veratrum and camphor is there, very good. Very good, away, very good. And carbolic acid is there. CPI is there. Valeriana is also there. Okay. These are the medicine about the coldness. Okay. But if you are talking about the cold sweat, so we can talk about the hot sweat. Hot sweat के लिए क्या क्या medicine है? No, lycopodium is not there. Lachesis is there. Okay, lachesis is there and opium is there. Very good, Ria. Opium is also there. Very good. Another symptoms: great appetite, craving for the meat, pickles, radishes, turnips, artichokes, and cold food. You can see in the picture, a patient is having great craving. Means there is so much craving, the patient is having tendency to eat beyond the capacity for digestion. Means a patient cannot digest the food, but he can eat 5 kg, like 5 kg, 4 kg he can eat. But the patient is not having the capacity for digestion the food. Like पेशेंट की जितने खाने की इच्छा होती है, he cannot डाइजेस्ट बट ही कैन ईट. मतलब डाइजेशन उसका अगर थोड़ा सा खाएगा तभी डाइजेशन अच्छा होगा, बट इसकी कैपेसिटी अगर खाने की बात करो, ही कैन ईट मोर देन द कैपेसिटी. मतलब अगर उसकी इच्छा है कि 250 ग्राम है, आधा किलो खा सकता है, बट ही कैन ईट मोर देन दैट. That is the characteristic symptoms of AbeisCanadensis. Another symptoms, what we have already told, another symptoms, cold shivering as if blood were ice water. Means a patient is having sensation of chilliness between the scapula and between the shoulder. Why? Because the patient feeling cold water between the scapula. But here we can correlate with the phosphorus. If there is a burning between the scapula, then the medicine is phosphorus. But if there is a sensation as if ice water between the scapula or between the shoulder, then can anyone tell me the name of medicine? That is Lacnanthis. Lacnanthis is the medicine. Okay. You can see in the picture, इतना सारा खाना है ये जो एबिस कैनाडेंसिस का पेशेंट है, he can eat like 5 to 6 pieces of pizza is there, he can eat. Okay, but normal patient cannot eat, but Abis canadensis patient can eat. Okay, beyond the capacity for digestion. Another medicine we will read, that is acetic acid. If you are talking about acetic acid, that is also known as glacial acetic acid and which is also known as vinegar. विनेगर का मतलब क्या होता है? जो सिरका होता है ना, हिंदी में सिरका बोलते हैं जिसको अचार में डालते हैं, so generally सिरका होता है acetic acid. Okay, and this medicine is introduced by Dr. Herring, but this medicine is proved by berries. Okay, and this medicine is prepared under class 3. Okay, so let's talk about the symptoms of acetic acid. Adopted to the pale, lean person with lax, flabby muscle and face pale and waxy. You can see in the first picture. In the first picture, there is a normal texture of the patient, but in the second picture, you can see pale and waxy face is there. This type of, if you're finding this type of face, then we can think of acetic acid and ferromate is there in the bracket. Another symptoms, hemorrhage from the every mucous outlet, nose, throat, lungs, stomach, bowels, uterus, and metrorrhagia and vicarious and traumatic epistaxis. You can see in the picture, there is a bleeding from the mouth, from the nose, or any orifices of the body. But there will be a vicarious. What is the meaning of vicarious? Vicarious means a bleeding can be there, can be from any orifices of the body. But traumatic epistaxis means, suppose if there is a trauma over the nose, so there will be epistaxis where there is a involvement or there will be a sources of the artery that is known as sphenopalatine artery is there, bleeding from there. Okay. Another symptoms, marasmus and other wasting disease of children, what we have discussed while we were reading Abrotanum. Another symptom, thirst, intense burning, insatiable, even for the large quantities in dropsy. Diabetes, chronic diarrhea, but no thirst in case of fever. Means a patient is having so much craving for the water. Means insatiable means उसकी desire fill नहीं हो सकती. Like he cannot drink only half liter of water, but he want a large amount of water, so he can feel the thirst. Okay. Otherwise, he cannot satisfy. That's why the word has been mentioned, insatiable. Insatiable की मतलब उसकी इच्छा ही नहीं पूरी हो सकती है. That's why you can see the child is drinking from the water, from the tap water, drinking direct from the tap water. If she will be drinking from the bottle, तो क्या होगा, एक बोतल पिएगा, but उसका satisfy नहीं होगा. He want more water. That is the meaning of insatiable. And generally, in which condition we will find? We will find in case of diabetes. So diabetes में क्या होता है? Yes, very good. So diabetes में क्या होता है? Generally, if there is a polydipsia, very good. And one more condition is polydipsia. Yes, three condition is there: polyuria, polyphagia, and polydipsia is there. This is the characteristic feature of diabetes mellitus. But if the patient is having fever, in this condition there will be no thirst. Okay, but here we can correlate with the another medicine, that is aconite napellus. If the patient is having fever, there will be a thirst, great longing for water, and burning thirst will be there for the large quantities of cold water. Burning thirst means he cannot be satisfied like acetic acid. He cannot be satisfied. Okay, he also wants a large amount of water. That is aconite napellus. Okay. Another symptoms, there is great prostration after injury, after surgical shock, after anesthesia. Suppose if the patient is coming to you and he is having so much weakness, but he will be telling you the history. डॉक्टर साहब, एक बार मेरा ऑपरेशन हुआ था, उसके बाद मुझे ये कमजोरी बहुत रहती है. And he will be complaining that I am having injury. अब जब से चोट लगी है उसके बाद बहुत कमजोर. या he will be complaining that अगर एक बार मैंने एनेस्थीसिया लिया था, आफ्टर दैट आई एम हैविंग सो मच वीकनेस, he will be complaining like that. But if you are getting this type of symptoms, so we can think of acetic acid and ferrum metallicum we can also think. But this symptom we can correlate with the another medicine, that is staphyscria. So what is mentioned in staphyscria? There will be a colic, pain after lithotomy or after ovariotomy. Means there will be a pain after the operation, especially the area where the stitches are there. In this condition, we can think of staphyscria. But if there is a pain after laparotomy, then the medicine is bismuth. Okay. Another symptoms, diarrhea, copious exhausting, great thirst in dropsy, typhus, phthisis with the night sweats. Means a patient is having diarrhea which is profuse. इतना ज़्यादा profuse होता है because the patient will become exhaust. Means great prostration is there. Means so prostration, इतना ज़्यादा exhaustion means उसको ना तो चलने की हिम्मत होगा न ही बोलने की हिम्मत. That is the meaning of exhaustion. Okay, and there will be a great thirst, what we have already read, insatiable thirst for the large quantities of water. And with night sweat, a patient will be having especially a night sweat. But if you are talking about the night sweat, so can anyone tell me the disease condition? Here we can correlate with the practice of medicine with the disease condition where there is a having a night sweat. Very good. Tuberculosis is there. Very good. Raj and Arya. Very good. And there are so many conditions. And like cancer. In case of cancer, in case of HIV, in case of osteosarcoma, these are the conditions where we will find a night sweats. Okay. Another symptoms, true croup, hissing respiration. You can see in the picture now there is a night sweat, especially in the patient. Okay. Another symptoms, true croup, hissing respiration curve with inhalation in the last stages. Means when the patient is inspiring or inhalation, so there will be a wheezing sound will be there or hissing sound will be there. What type of sound? This type of sound you will find when you will put a stethoscope over the pulmonary area, over the chest wall. You will find a hissing sound. You will find this type of symptom or this type of sound. But if you are talking about the hissing or wheezing sound, so can anyone tell me in which disease condition we will find a wheezing sound? Can anyone tell? Bronchial asthma, very good, and very good. COPD and pneumonia is also there. Okay, etc. Okay, very good, excellent. Another symptoms you can see in the first picture. Okay, cannot sleep lying on the back. But if the patient is sleeping better on back, then the medicine is, can anyone tell? The name of medicine, patient feels better, arsenic, very good, arsenic album is there, very good, very good, arsenic album is there. And there is a sensation of sinking in the abdomen causing dyspnea. Means a patient is feeling emptiness in the abdomen and which is causing dyspnea. Means there is a problem with the respiration, means breathing difficulty will be there. But in the second picture, you can see the patient is raised better lying on the belly or abdomen. Can you tell me the more medicine? The patient feels better lying on abdomen. Can tell me Very good. Acetic acid and medorinum. Very good, Raj. And ammonium carb is there. Very good. Very good. In the bracket, acid is also there. Okay. Another symptoms, hectic fever, skin dry and hot. Means hectic fever means what? Means a patient is associated with the chilliness and sweat, especially a night sweat. So there is a redness in the left cheek. You can see in the picture there is a red spot on the left cheek and drenching night sweat. What is the meaning of drenching night sweat? Means drenching night sweat means if you will look the patient of acetic acid, he will look like he has taken bath into the water. ऐसा लगता है कि पानी में नहा लिया हो, इतना ज्यादा स्वेटिंग होता है. दैट इज द मीनिंग ऑफ ड्रेंचिंग नाइट स्वेट. ओके, ड्रेंचिंग नाइट स्वेट और किस मेडिसिन में होता है? कैन एनीवन टेल? That is ars iode, arsenic iodatum is the medicine which is mentioned in the boric Materia Medica. Okay, where we will find a drenching night sweat. Okay, but if you are talking about the red spot on the left cheek, then we can compare with the another medicine where we will find red circumscribed spot on the cheek. Can anyone tell me the name of medicine? Yes, very good, Devosmita. Sanguinaria-canadensis is there. But if there is a one cheek pale, another is cold and hot, can anyone tell me the name of medicine? Not arnica, chamomilla is there and aconite is there. Okay. Okay. Another symptoms, acetic acid has the power to liquefy the albuminous and fibrinous deposits. Suppose if the patient is having albumin deposit in the joints or fibrin deposit in the joints, then acetic acid is having so much power to dissolve it, to liquefy it. So we can think of in this condition, if the patient is coming to you and he is having fibrinous deposition or albuminous deposition in the joints, so we can think of this medicine. And this medicine we can think about the epithelial cancer, means we can generally think of ovarian cancer. We can think this medicine and we can use either internally or we can also use for the local purpose, means we can use as an external application. But if you are talking about the external application, so we can talk and we can correlate with the organon of medicine. Can anyone tell me where Dr. Hahnemann has advised about the external application? Can anyone tell? Can anyone tell where the Dr. Hahnemann has advised about the external application? जस्ट आप लोग चेक कर लेना एफोरिज्म नंबर 282 वेयर द लार्ज डोजेस ऑफ मेडिसिन इज मेंशन about the thuja. In case of what we can use external application. Okay, another symptoms, psychosis with the nodule and formation in the joints. What we have already said, if there is a formation of the any growth or psychotic nodule will be there, like osteophyte is there, then we can think of this medicine, that is acetic acid. Okay, another symptoms, irritable and worried about the business affair, means you can see in the picture, if there is a business, so always he will be thinking about the business, what's going, and we will lose, and we will having so much problem if we will lose our business. Always worried while he will thinking about the business affair, that is acetic acid. But if there is a embarrassment after losing the business property. So can anyone tell me the more medicine? Like ambragracia is there, sepia is there, and no, in case of brania is not there, and one more is there, that is hyoscyamus is there. Okay, and calibrome is also there. Okay. Another symptoms, diabetes with great thirst and debility, means the patient will be having so much thirst and there will be a weakness. Why? Because if there will be a patient, if the patient is having diabetes, so there is passing of more glucose into the urine, and that condition is known as glycosuria. So body में क्या होता है, ग्लूकोज की कमी हो जाती है. That's why the patient is having so much debility. In the bracket there is a medicine that is known as a phosphoric acid. Okay. But अगर जुवेनाइल डायबिटीज होगा तो कौन सी मेडिसिन है? Can anyone tell? If the child is having diabetes, so can anyone tell me the name of medicine? Yes, very good, Devosmita. Crataegus is the medicine. Crataegus oxygenantha is the medicine where there is mentioned of juvenile diabetes. But if there is a diabetes with impotency, can anyone tell me the name of medicine? Diabetes with impotency. Can anyone tell me the name of medicine? Diabetes के साथ impotency होगा. Can anyone tell? Coca is the medicine and phosphoric acid is also there. Okay. Another symptoms, the 1x solution will soften and cause formation of the pus. You can see in the picture, if the patient is having something eruption, so it will make the area very soften and it will help to the formation of pus like Hepassulp or like Silicea is there. Okay, it will always help to the formation of pus. Okay. Another symptoms, anemia of the nursing mother. You can see in the picture, those mother were nursing her children or her baby, they will be always suffering from the anemia. And if the mother is suffering from anemia, especially while the lady is nursing his child or baby, in this condition, we can think of acetic acid. Okay. Okay, thank you everyone. If there is any doubt, you can text me, you can call me, you can ask me. Is there any doubt?